Hey, Alpha Nurses, I'm Licensure from AlphaNurseGuide.com. This is 5 NCLEX questions. Without delay, let's get started.
A client with acute respiratory distress syndrome has fine crackles at lung bases, and the respirations are shallow at a rate of 28 breaths per minute. The client is restless and anxious. In addition to monitoring the arterial blood gas results, the nurse should do which of the following? Select all that apply. 1. Monitor serum creatinine and blood urea nitrogen levels. 2. Administer sedative. 3. Keep the head of the bed flat. 4. Administer humidified oxygen. 5. Auscultate the lungs. The correct answers are 1, 4, and 5. Acute respiratory distress syndrome may cause renal failure and superinfection, so the nurse should monitor urine output and urine chemistries. Treatment of hypoxemia can be complicated because changes in lung tissue leave less pulmonary tissue available for gas exchange, thereby causing inadequate perfusion. Humidified oxygen may be one means of promoting oxygenation. The client has crackles in the lung bases, so the nurse should continue to assess breath sounds. A client with acute respiratory distress syndrome is showing signs of increased dyspnea. The nurse reviews a report of blood gas values that recently arrived. Shown below, pH is 7.35, PaCO2 is 25, HCO3 is 22 milliequivalents per liter, and PaO2 is 95. Which findings should the nurse report to physician? 1. pH. 2. PaCO2. 3. HCO3. 4. PaO2. The correct answer is 2. The normal range for PaCO2 is 35 to 45. Thus, this client's PaCO2 level is low. The client is experiencing respiratory alkalosis due to hyperventilation. A client has the following arterial blood gas values. pH is 7.52. PaO2 is 50. PaCO2 is 28. HCO3 is 24 milliequivalents per liter. Based upon the client's PaO2, which of the following conclusions would be accurate? 1. The client is severely hypoxic. 2. The oxygen level is low but poses no risk for client. 3. The client's PaO2 level is within normal range. 4. The client requires oxygen therapy with very low oxygen concentrations. The correct answer is 1. Normal PaO2 level ranges from 80 to 100. When PaO2 falls to 50, the nurse should be alert for signs of hypoxia and impending respiratory failure. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at AlphaNurseGuide.com. Back to the questions. Which of the following conditions can place a client at risk for acute respiratory distress syndrome? 1. Septic shock. 2. Chronic obstructive pulmonary disease. 3. Asthma. 4. Heart failure. The correct answer is 1. The 2 risk factors most commonly associated with the development of ARDS are gram-negative septic shock and gastric content aspiration. Which of the following complications is associated with mechanical ventilation? 1. Gastrointestinal hemorrhage. 2. Immunosuppression. 3. Increased cardiac output. 4. Pulmonary emboli. The correct answer is 1. Gastrointestinal hemorrhage occurs in about 25% of clients receiving prolonged mechanical ventilation because of the development of stress ulcers. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at AlphaNurseGuide.com.